The following video should be used in conjunction with the instructions for use packaged with every Posy product and your facility's policies and procedures. The Posy limb holders are used to restrain a patient's limb movement. Limb holders are indicated for use on patients assessed to be at risk of disrupting life-saving treatments. For example, chronic tube pulling, patients assessed to be at risk of line pulling, which may prevent monitoring of vital signs, and patients whose picking, pulling, scratching, or peeling exacerbates a skin condition, causes self-injury, or compromises wound site integrity. It's important to note that this Posy product is a prescription device, RX only. The Posy 2550 is a quilted limb holder with a quick-release buckle wrist closure and double connecting straps. To begin, wrap the limb holder cuff around the patient's wrist so the buckle is on the side of the wrist opposite the thumb. Secure the hook and loop fastener. The cuff must be snug but not compromise circulation. Slide one finger, flat, between the cuff and the inside of the patient's wrist to ensure proper fit. Close the quick-release buckle on the cuff. Listen for a snapping sound. Insert two fingers, flat, under the buckle and pull the strap snug, but not so tight as to restrict circulation. Attach the hook end of the cuff strap to the fuzzy backing on the cuff to keep the quick-release buckle from sliding. There are two types of bed application procedures. Use the triangulation process to restrict the patient's range of motion. Separate the straps. Wrap the lower strap around the outer side of a movable part of the bed frame, out of the patient's reach. Bring the strap across and then behind the vertical strap to form a loop. Take the end of the strap, form a second loop, and bring it through the first loop. Pull down to tighten and tuck any excess strap out of reach. Repeat with the upper strap. To increase the patient's range of motion, wrap the straps together around the outer side of a movable part of the bed frame out of the patient's reach. Bring the straps across and then behind the vertical straps to form a loop. Take the end of the straps, form a second loop, and bring it through the first loop. Pull down to tighten and tuck any excess strap out of reach. To release the straps, pull on the tail of the straps. To remove the cuffs, unsnap the quick-release buckle and release the hook and loop fastener. Posy recommends that full HBSW compliant side rails in the up position be used when a patient is restrained and unattended. Use side rail covers and gap protectors to help prevent the patient's body from going under, around, through, or between the side rails. The preceding video demonstrates the proper application of Posy products only. Prior to application, consult your facility's policies and procedures regarding the appropriate use of this product. The video should be used concurrently with the Posy application instructions, which include indications, contraindications, warnings, and more detailed product application information. Product application and instructions for use are included with each Posy product. You may contact the Posy company to request the product application instructions or download a copy at www.posy.com. If you have any questions, please contact us at 1-800-44-POSY.